BonSecours is a group of hospitals, of 5 hospitals spread throughout the country. The BonSecours Hospital in Cork is the biggest hospital, comprising approximately 1,100 staff, and it is the Cork Hospital that was the site for the pilot project for time and attendance. Yeah, as regards our shifts, it's all of the above. Flexible, non-flexible, floating, everything you can imagine is in a hospital environment. Also with regards to the type of staff we have, again, because it's a hospital, you have everything from admin staff to services such as IT and maintenance, through to specialist clinical staff, specialist nurses, doctors, pharmacists, you name it. It's a very diverse environment, and every employment you can think of will be represented here somewhere, I'm sure. I think the main motivation we had for installing Softworks was that the systems we had at the time were paper-based systems and manual systems. As such, we did have a time and attendance system, but it was just a very cumbersome and a very ineffective one. So our motivation behind purchasing Softworks was to remove all of that, all those middle layers that prevented us paying the employee on time and correctly 100% of the time, and replace it with an electronic system that would have the added benefit of management information, which could be extracted easily through reports. I think the biggest challenge we had is that our motivation was to make our systems more efficient and to involve all of the staff in that process. It wouldn't have been sufficient just to have 1 or 2 or even a dozen departments involved. We needed the whole hospital involved in this. So our biggest challenge was to get all of the staff behind us, and they did. In that I think all staff appreciated the benefits that would be accrued to the hospital overall, and that these benefits would be felt by all staff and would help us to become more efficient in terms of as a hospital, and also that those efficiencies would be passed on to staff through payroll and to the patient in terms of a better, easier, quicker stay in the hospital. Our main use of the system at this point in time is for leave management and rostering. And when I say leave management, I mean all the absence types, be it everything from maternity leave through to time in lieu, and the viewing of those balances and the reporting of them. That coupled with the day-to-day tracking of staff in and out of the hospital from a health and safety point of view, but also in terms of the employee record, is probably the biggest thing we're taking out of the system at the moment. There are a few issues, or a few things we're not doing with it at present, but we can see a lot of potential, especially in areas like integrating it further into payroll and using some of the add-ons such as expenses module, or perhaps moving into cashless tills and these kind of things later. But at present, it's all about the management of time and of absence. Well, we have a number of different user types. I mean, at the top level, of course, we have the administrator who has total access to the system, and we've appointed administrators from our nursing, our HR and our payroll sections. Now, previous to Softworks, we would have had an amount of people in each of those areas being involved in the day-to-day running of getting payroll from one end to the other. But now what we've done is we've appointed one person from each section into a TAMS, as we call it, Time and Attendance Management System, administration group. So they look after the day-to-day needs of the system. And our biggest users after that would be the managers, the department managers, who would use the Clockwise application and would use that to roster their staff, to look at the balances that staff has as regards time in lieu and leave, and also look at the day-to-day movements of the staff through the clock card, and also of course approve or disapprove leave as required. Our next level of user then would be, what you perhaps call the end user, which is all of our staff out there who use the ESS system. They use that to basically apply for leave, to view their own balances in terms of leave, and look at their own history so that they can see when they took leave before, etc. And I think that with most staff, they found that very easy to use and are very happy with it. The Clockwise system has gone down well, is the best way to say it. The Clockwise system is widely used by our managers, and the feedback we're getting is that they like the system. It's intuitive, it's easy to use. and it's very easy for them to move into, having done other systems. It's very modular, and through the administration we're allowed to give and take different modules depending on the needs of the user. So you don't overclutter the environment or present menus and options that are of no use to a particular manager. I think they like that, and I think they find it easy to use. On the staff point of view then, when using the ESS system, which is web-based, the options are clearly laid out. It's lesser in terms of functionality than Clockwise, so they get exactly what they need, which is apply for leave, view your balances. They're the things they're interested in, and that's what they get. Biometrics involves a change of mindset as regards a lot of your staff, in that there may be some concerns about that I'm giving over some of my very personal information here. So that was probably our biggest challenge, was to encourage the staff to use the biometric system, not force by any means. So it was to get the information out there that biometrics involves not really taking a photograph of your finger. It's more of, it's taking a view of some information that physically makes you distinct and unique. And I think we did get good buy-in from our staff in that regard. Some staff were hesitant, so we gave them the option of using the PIN rather than the biometric, which is also possible from the same unit. After that, our biggest challenge was the fact that we wanted to put 14 biometric units placed around the hospital in many different locations. That seems quite large, but in an environment like a hospital where you have many exit and entry points, many different departments running almost 24 hours, it made sense to us. So one of our biggest technical challenges was synchronizing all of these biometric units so that we could enroll a person, move that information out to all the units, and likewise when a person entered or exited the building, that information would come back to a central database where we could report on it. I think we achieved that, and it's probably one of the greatest achievements of the project in that regard. Nursing is a department that has requirements of rostering that are incredibly flexible. Nursing needs to be rostered well in advance, weeks, months in advance. In addition, it has to accommodate changes to the roster that would happen on a weekly and a daily basis. Likewise, it has to accommodate some of the standard practices within nursing, such as swapping shifts, etc. So we needed maximum flexibility from the system. And I'd have to say that when we first got Clockwise, the rostering modules didn't accommodate all of our needs, but we worked with Softworks and customized the system with Softworks to get the system that we wanted. And the system we wanted was one that matched exactly what our historical rostering system was, which worked for us. Except it now needed to be electronic. Now it is, and it works. So that's probably a great achievement that we've done for the project. Yeah, I think one of the greatest benefits we've got is in terms of management information. Prior to Softworks implementation, obviously, as I said, we had a system in place, but it was a dispersed system where we had information held in silos in each of the departments or within service departments such as payroll or HR. All in a disjointed way, it was very hard to develop any kind of meaningful data. Now with the system that we have, entire personnel data, including leave balances and the accrual of time in lieu and how that time in lieu is returned, etc. It's very easy for us to put that all together in meaningful reports very quickly. So that would have to be one of the key deliverables that we got out of the system. Secondly then is from an employee point of view, they're more engaged, because previously if an employee wanted holidays, they would go seek out their manager wherever they were in the organisation, put in an application. Now it's all done electronically, it's all done quickly, balances are there for the employee to see, which they didn't have previously, and likewise an employee can see their own ins and outs as they are on record on the system. I think from each employee's own personal level, it would certainly encourage them to be on time, and also it would encourage them that when they have worked extra time to seek out just reward for that, because the system clearly records that they have worked the hours and that they should get the time back. So there are benefits there for the employees as well as from a management level in terms of reporting.